Hi everyone, I have the condition Parkinson's disease and I chose this because my grandpa currently has it and I wanted to learn more about it. So what is Parkinson's disease? It is a brain disorder and it will worsen over time. Nerve cells and neurons that control movement in the brain either die or become weakened, and they produce dopamine that control these movements. So once these neurons die or become weakened, this creates the Parkinson's movement issues. Researchers do not know why this happens. They also lose nerve endings that produce norepinephrine, which control the automatic functions. So this explains why they have fatigue, blood pressure issues, or decreased movements. There's 5 different stages, and the first stage is mild symptoms, and then it advances to stiff limbs, and they need aid throughout the entire day. Signs and symptoms, there's a lot for this disorder. So I'll hit the main ones, which is shaking, stiffness, difficulty walking, mental and behavior changes, tremors, movement slowness, difficulty swallowing and chewing, and one side can be infected and then the other side will gradually be affected too. And stooping, hunching over, and also a masked face. Risk factors. Both genders can be affected, but men are 1.5 times more likely than women. They develop it at the age of 60, and they can have an early onset, which happens before the age of 50, and 5 to 10% of people have this. It can be hereditary, but it can also be random and not passed down through the families. Researchers believe it is caused by genetic environmental factors such as toxin exposures. Diagnosis. The family physician is typically the first to diagnose, but they want to send them to a specialist. But for a neurologist to diagnose Parkinson's disease, you have to have 2 of the 4 symptoms. And typically, there's treatments that relieve some of the symptoms, but there is no cure. And on the left side is rating scales that measure the progressiveness of their Parkinson's disease that doctors will use. There's many different medications, but overall the drugs that increase the level of dopamine affect the brain chemicals in the body and improve the non-motor symptoms. They typically will take levodopa, which mimics dopamine, but they have to take carbidopa as well because of the side effects levodopa gives off, which is nausea, vomiting, decreased blood pressure, and restlessness. They can have deep brain stimulations as well, which this will be replaced instead of medications, and it implants electrodes into the brain and connects them to the electrical device implanted into the chest, and it stimulates the brain to eliminate movements related to Parkinson's disease. And they can go through different therapies as well. Related to dental hygiene, you have to be prepared and be knowledgeable about Parkinson's disease to prevent medical emergencies such as tremors throughout the appointment. And this is not only a new concept for them, but for us as well. So their daily lives are constantly changing. So as experts, we need to give them as many aids as we can to help their oral health. We need to keep track of their progression because, as we know, we typically see patients more than they see their physicians. So we can see how far they are advancing to Parkinson's disease and have knowledge on medications so we know if there's any contraindications to procedures going to be done. Medical history. ASA3 if it's controlled and mild, and ASA4 if it's untreated and severe. Possible questions. When were you diagnosed? What symptoms do you have? If they have tremors, how often do they occur? Do you take medications to control your symptoms? How advanced is your Parkinson's disease? And if they had any surgeries. Dental considerations. Because of their rigidity and tremors, it can make brushing one's teeth very difficult. And these symptoms can cause effraction and attrition and change of their fit of dentures. And also fatigue and anxiety and their tremors can create a problem to attending their appointments, or it can make it difficult to be there for a long period of time. If taking MAOB inhibitors, this can interact with anesthetics, and consider to do more difficult procedures at the beginning stages of their Parkinson's disease because as they progress, it can be harder to do these procedures on them. If a patient has tremors, be cautious of their surroundings and do not have the patient stand up right away because of vertigo. Emergency and complications. If patients have tremors, they can accidentally hurt themselves with surrounding instruments, and it can be difficult for them to swallow. And also temperature and respiratory rate can increase. So what to do? Just always monitor the patient, record their vitals, and be aware of the patient's surroundings. Oral manifestations. Too much saliva due to their drooling can create fungal infections on the side of their mouth. Xerostomia from medications create caries and difficulty swallowing. Fraction attrition can occur from tremors. Also, tremors can make it difficult to keep their dentures in. And medication and dry mouth can cause burning sensation. Dental management. Use a pillow if they cannot be in supine position. Make the appointments in the morning so they do not have to wait as long, or schedule when their symptoms are controlled. Keep sharp items away and have them demonstrate how they take care of their oral cavities so you can give them aids to improve on their oral health. Home care products. Keep oral hygiene routine thorough and make sure that if they have dentures, they're taking them out at night and cleaning them. They may need a mouth guard or retainer to protect their teeth, and they may need a specialty toothbrush for them to hold and grip better. Also, an electric toothbrush can help with that because it adds more weight into their hand. They may need a water pick to reach the interproximals, and to use sugar-free candies and gum to help with saliva flow, as well as biotin products to lubricate the mouth. Drink more water to neutralize the mouth and keep the mouth moist, and also it will help them swallow foods better. And use fluoridated products to prevent caries from xerostomia and to neutralize the oral cavity. So some takeaway points is patients with Parkinson's disease have many different symptoms, and no two patients are alike. As hygienists, we need to give recommendations to these patients because they are constantly having changes done in their lives, and as experts, we need to help these patients. And here are my references.